Alright, so today we will be demonstrating inserting a urinary catheter. And so we're going to go ahead and start through that process. So we're going to verify the doctor's orders, which we have done. Then we're going to introduce ourselves. So, hello ma'am, my name is Gerald, I'll be a nurse this evening. And then we're going to provide patient privacy by either shutting the door or drawing the curtain. And then we're going to go ahead and perform hand hygiene over here. And then, so after we do that, we want to identify the patient. So, ma'am, can I have your name and date of birth?
Crystal Gann, 10/10/2000.
All right, good. Are you allergic to anything, specifically to iodine or shellfish?
No.
All right, good deal. So what we're gonna do today, we're gonna go ahead and insert a catheter into you, per the doctor. So I'm gonna go ahead and assess your bladder. So before you touch the patient, you always want to put on gloves. And so now we're going to go ahead and continue to assess the bladder. And so, alright ma'am, the reason for this catheter is you're having trouble voiding and your bladder is a little distended. So that's why the physician would like us to insert it. And so once you've explained the process and everything and you've assessed the patient's bladder, you want to go ahead and gather all the supplies. So here I have a few washcloths, and I've got the foley catheter tray. Depending on what size is in here is what we're going to use today. So we're going to be going with the 14 French today. And so, now that we've gathered the supplies, we want to go ahead and we're going to raise the bed into a comfortable working position, as well as the bedside table. And then we're going to put the patient into a dorsal recumbent position. So what we're going to do is we're going to lay her flat. Miss Moore, sorry for the visual here. And then we've got the patient's legs bent a little bit. Typically they would kind of go out like that. And so after you've put the patient into that position, you're going to go ahead and clean the patient. So I've got a washcloth here with soap. And so when cleaning the patient's peri area, you want to start with the farthest side, and then you want to come over to the near side, and then down the middle. So we're going to clean this side first, and then whenever cleaning the peri area, you never want to use the same area of the washcloth. So we're going to flip it around, clean that area, and then flip it inside out. And then you clean down the middle, and then you would dispose of the wash rag in the linen basket. Alright, so once we've cleaned the patient's peri area, we're going to go ahead and cover them up. You always want to keep your patient covered as much as possible while we go ahead and open our sterile catheter kit. And so we're going to change our gloves and perform hand hygiene. Alright, and so before you open a sterile kit, you always want to examine it just to make sure that it hasn't been opened or there's any tears or any kind of, anything that's going to make it not sterile anymore. So we're going to go ahead and open this now. So the outside of the package is not sterile. And we can use this to kind of dispose of our things as we go. Alright, so when opening this, the first flap always goes away from you, and you always want to grab just the outer inch only. And then the last flap would come towards you. Alright, so now that we've gotten to this process, you want to kind of come over your working area, and you want to grab the drapes and the pair of sterile gloves only, like so. And then we're going to let's see, we're going to set them here. Use this. Alright, so we're going to put kind of like a blue pad under the patient just in case we get water or anything like that. So I will not be using this pair, but so this drape here is for whenever you're going to cath a male patient. So we're kind of just going to put this over to the side. Let's see. Oh, how did I get this thing? So when putting the drape down, you want to do shiny side down. So we're going to come in like that. And so now we're going to go ahead and change into our sterile gloves. Let's go into the discard of this stuff. Here. So I do some hand hygiene. And so, when putting on sterile gloves, you always want to make sure, same technique, outer inch only. And you want to try to prevent it from going back inside like it just did. So it's always good to kind of like snap right there. And then with 2 fingers, you want to grab over here. Because this glove is sterile, you can't touch the inside of the glove. And you kind of just want to pull it over. So once it's on for the most part like that, you can grab it and adjust it. Alright, so since we do have sterile gloves on, we can touch the inside of this pack. So we're going to go ahead and come over here. So we're gonna go ahead and get the catheter ready. So you want to go ahead and get this and just have it ready to inflate the balloon. Move that there. All right. Before we go any further, we're gonna go ahead. So you would use the iodine, you would kind of place it in there. And with these, you would grab these cotton balls here. And with these, you want to basically kind of the same concept with the washcloths. Always want to start furthest from you. And so we're going to start with the furthest. So you would wipe down like that. And then you would discard of it. Alright. And then we're going to go ahead and wipe down this way. Get rid of that cotton ball. Alright. And then the final cotton ball, you want to just go straight down the meatus. Get rid of that. Alright. So once we've cleaned the patient, you would take this syringe here. Then you would squirt it out in a certain area of the tray, any area you want. And then you would take the catheter out of this wrapper. As it's moving around everywhere like that, you don't want that. So you kind of want like a firm grip on it, maybe 4 or 5 inches. And what you would do, you would twirl around in the lube. And so let's say it's all lubed up. And so with the left hand or your non-dominant hand, you will kind of spread the labia, and then you will insert the catheter into the urethra as such. And whenever you're so a way to tell you if you're in the bladder or not, you will see pretty quick return into the foley bag. And so once you start seeing return, you want to inflate the balloon. You know, not too fast. And then you can just pull back, and that's how you know you're in. It won't come out anymore. Alright. So we're going to take off sterile gloves here. And hygiene. We're gonna put these gloves back on. So you want to place the Foley bag, obviously below the bladder, and you never want to place it on the bed rails, so you always want to just hang it on the frame of the bed, as so. I'm going to go ahead and clean up after our show. And then just cover the patient up. Oh, before we do that, you want to tape or secure with some kind of device the Foley to the patient's leg, just so it's not constantly pulling on it or giving it any tension. And so that is how you insert a Foley catheter into a female patient. Alright, man, so that was that. Are you in a comfortable position?
Yes.
Alright, so we're going to go ahead and make sure the bed is locked and lowered. We got two side rails up. And then, place the call light, just make sure the patient doesn't need anything before we leave, and then we're done. And so we're gonna take these gloves off and then perform hand hygiene before we leave. And that is that.